Good afternoon, Ingrida. How are you?
I'm good. Thank you so much, Lily, for having me here today.
Come on, it's always a pleasure. We kind of started our health, exercise, fitness journey together, and you inspired me so much. So I'm always happy to find a reason to have a chat with you and to share our conversation with whoever wants to hear it.
Yeah, absolutely. I'm up for that. So let's do this.
Yeah, let's do it. So I know you pretty well, but most people that will be watching this video might not know you. So maybe I'll let you introduce yourself.
Yeah, I'm happy to introduce myself. So I'm Ingrida, and I am practicing functional medicine in the clinic called my functional medicine clinic. I work mostly at balancing hormones, healing gut, and my latest baby is body transformation program. It's a bit of combination of everything, my own experience and the studies that I done. Literally, it's changing your body's chemistry and rewiring your brain with neuroencoding techniques so you can achieve the results faster and go further in life.
Okay, so break it down to me as if I was like a 5 year old. So why would I come to you?
Why would you come to it? Because we together gonna have fun. I don't like strict diets. I've been on the strict diet myself, and you've been there too. They work, absolutely. We both got amazing results, but I like to have a happy life. I made the rocky road yesterday because I wanted to, and I can have it as long as it's in balance. So my principle is basically your whole foods, 80% of the time we feeding our body with the right nutrients. And then 20%, sometimes 10, maybe sometimes yesterday was the whole 50%. All that rocky road went into me. And it doesn't mean that you're gonna change something or, oh my gosh, I'm gonna, not gonna ruin my progress. It's all about balance. And that's the program, what it does, all about balance. And also understanding where the imbalances are coming. Me, as a functional medicine practitioner, nutritional therapist, I like to employ the tests like GI 360, which is a gut test, or Dutch test, hormone test, to understand, especially us females, when we hit perimenopause, menopause, the diets that worked in 20, yeah, me too. It just doesn't work anymore. And we're frustrated and not happy. And we're still comparing our progress to other people's progress. So it's all about really learning your body, understanding your body, and loving yourself and being happy with yourself, because that everything starts working.
Yeah, and probably taking the time because very often I hear people like, "Oh, I need to lose weight because I have this wedding." And
Yeah.
what happened after the wedding?
Yeah, that's the whole point. Exactly, you exactly said, Billy. It's about changing that lifestyle and not having the short-term goals is they are great, but when it comes to your body is literally your house. You
Yeah.
want to be happy in your house. You need to maintain that house as well, as every decade, every year, everything changes. So you need to upgrade a little bit, something. And the most important mechanism that I like to upgrade in my personal life is this software, because, it doesn't serve sometimes. So we need to upgrade, to level up and upgrade and start feeding things that makes us,
Yeah.
happy, empowers us, and doesn't have to be much. Simple things in the morning, like looking in the mirror and saying, I love you, Ingrida, or I love you, Libby. And really starting loving, starting appreciating yourself, giving time to for yourself and to enjoy
Yeah.
life more. And when you fall in love with yourself, you don't need compare your progress to someone else. You're just happy the way you are.
Totally.
That's the whole program, the 3 months body transformation.
Okay, cool. That's super interesting. Now, not everybody understands because we hear about, oh, I need to see a nutritionist. I need to see a nutritional therapist.
Yeah.
Can you tell us exactly what a nutritional therapist is and maybe what's the difference between what you do and maybe what a dietitian would do?
Yeah.
Because
Yeah.
then I can go and to a personal trainer.
Yeah.
He or she will claim that she will help me lose
Yeah.
weight. Like you have so many approaches. So
Yeah.
what it is
Exactly.
that you do exactly compared to the rest?
Yeah. So I can say like in terms of nutritionists, because nutritionists, everyone can be nutritionist. You just do online a course, few weeks, few months course, and you're nutritionist. I started the whole thing with becoming a nutritionist first, specializing in sports. And all I knew is how to change the physique, the body by changing your macros, working with the calories, and doing these things, which are very important. But that wasn't enough for me. I always was curious. I wanted to learn more. Well, what is the nutritional therapy? And uh, and actually, it's interesting because you go in the root cause because nutritional therapy. A lot of people now employ functional medicine module. Then they work with a nutrition. When they are nutritional therapists, they do the functional medicine module. That means go deep and understand the roots where these are coming from. And there's different approaches as a nutritional therapist. You can start with very precise questionnaires to understand different body systems, what is happening. Could be you have a lot of face like problems, on face, pimples, things like that. And you might never understand and might never, understand that it's your gut or that's your liver not working correctly. These links, could be linked. So nutritional therapists will help you to find out where are the root causes. I like, as I said, using functional medicine testing. My favorite is gut and hormone testing to understand your body's chemistry. And then based on your body's chemistry, what it says, and based on your questionnaire, you can connect all the dots to understand the roots and to create the protocol, not to treat your symptom, whatever the rash you have or the headache you have, not that thing, but actually go in the roots because you see there are certain imbalances and address these roots. So that's the difference. And dietitian, I think, I'm not sure dietitian, they do the diets. I always had this impression that dietitian works in the hospitals, but actually that's not true. They can actually also practice it. Just I think different approach dietitians do. They also do the assessment and just creates. It's I think very much government here regulated, and you have to comply. There's a lot of protection what you do, what you not do.
Mm,
It's a different approach, but yeah, I can only talk how I'm trained to
yeah.
find the roots with the testing and with the questionnaires. So
Okay. So the
yeah,
beauty of what you're doing is like you're not focusing on the symptoms. It's not about, hey, this is what we see, let's change that. It is
yeah.
what's the reason for that? Then we understand the cause. So then we can prescribe a
Mm.
change that's going to be sustainable because we will have fixed the root cause of the problem.
Exactly. Yeah, it's good to address the roots and not to take a painkiller,
Just
to
put a
practice.
band-aid on it, like we tend to do
Yeah,
these
yeah,
days.
yeah,
It's all about
exactly.
finding a quick fix.
Yeah, there's no, unfortunately, functional medicine, nutritional therapy, there's no quick fixes, not at all. So my mentor, Dr. Datis Karazian, when I attended his clinics, and his clinics were, geez, Lily, so complex. People would be with the chronic diseases that were suffering for their whole life. And it's not like 3 months treatment. It's about at least 1 year working with him, or 2 years in some cases. And sometimes even that's not enough. Depends what is going on. So in my practice, I don't do cases like this complex like he does. But yeah, but it works, once you start working, it works.
So if you look at the typical client that you get what is your, okay, what are the top three reasons or symptoms that people come about or for?
So the one of the main symptom is that they just don't have energy anymore and they don't understand what is it. Is it my thyroid? Is this like they just drag like zombies in the morning. They don't. The other type of clients that are coming is a lot of digestion issues. And most of the time, I'm also SIBO qualified doctor. So I work with the SIBO patients and it's a small intestinal bacteria overgrowth that we don't talk enough.
Yeah, please tell us. Okay, I'll let you think answering that question, and then you can tell us about what SIBO is exactly.
Yeah, yeah.
So
So
that
what
you gave us two typical clients. What's
Yes,
the third
SIBO
one?
clients, energy client, and weight loss clients. So these would be my three main that are coming. So not necessarily, sometimes SIBO might not be, so sorry, gut client may not be SIBO. Without the testing, you would never know.
Yeah.
So it's good to test to understand what exactly is happening into your body.
And what is SIBO now? Can you tell us a bit?
So SIBO is the small intestinal bacteria overgrowth. That means it's not a bad bacteria, but the location is bad. These bacteria migrates from the colon into your small intestine, eats your food, the food you eat, start making the babies, start producing the gas. You look like you are like seven. If you're female, you look like you are 7 months pregnant and from time to time just barely pops out. There's a big, sometimes can be big pain, especially for men with SIBO. They don't get the blow, but they get very strong pain and they don't know what to do. Could be constipation, could be diarrhea, could be a bit of everything. And really the treatment depends. Once you do the SIBO breath test, you understand what type of gas is there. Is the hydrogen, methanogen, or is a combination of both? And what type of gas is there? You start the treatment protocol to eliminate that. And SIBO is something that it's not easy to remove. So it requires a lot of work from the patient, from the client, that they are committed to work. And there's no really one thing fit all, because parallel, it's good to run the gut test as well to understand your whole gut microbiome to create a protocol that would work and eliminate the SIBO. So it's a huge work, at least 3 months, if not longer.
And how do you get a SIBO? How do you get it?
The different stress is one of those. Common thing. Food poison is another one. Yeah, it's different. I even don't know how people do get it, but they do get it. It's quite common, especially, and it's a mystery disease. It's a mystery thing, or we call it umbrella term. It's IBS when we don't know what it is.
Yeah.
Why the symptoms?
Because now I'm thinking I was looking at my belly this morning and I was like, okay, like I train, I eat healthy, but I feel like I have a little tire, small tire around my belly. But then I
Yeah,
was like, this
yeah,
is due to the hormones, right? The change. I'm 47. I can feel like there is a layer, and I was like, okay, this is not a SIBO, obviously. This is just
yeah,
fat in
yeah,
the wrong area.
yeah.
Okay, so just for people, because people would be wondering, oh, do I have a SIBO or do I know somebody who has one? So, what are the top three symptoms
So
one should observe and be like, oh, I might have a
yeah.
SIBO?
Actually, the symptoms can vary, but the most thing is your bowel movement. So, are you constipated? Are
Okay,
you diarrhea constantly? Or could be a mixture. Sometimes you constipated and sometimes out of blue there's diarrhea.
okay,
Is there any pain happening in your abdomen area? Is it
okay,
strong? Is something that you never had and now you keep having it? And
okay,
then when you bloat, do you bloat really bad? And that's
okay.
what you, because it just is bloat. It's happening and keep happening and keep happening. You just don't know. You look flat and here you go. Next minute, whoop,
Wow. Okay,
yeah.
that's very clear. So,
Yeah, and then it affects your brain as well because it just, you know, of course, when you're not happy here in the gut, everything is communicated to your brain and how it's just people are so miserable and so not happy in their brain as well. And of course, when you have these symptoms, like who would be?
Wow. Wow,
Yeah.
that's
So
super
yeah,
helpful because to be honest, I had no idea um
yeah. So
what a
so
SIBO was
yeah.
clearly. Yeah.
Yeah, and like no one, no really, because when I studied nutritional therapy, I never really, we just covered that as a umbrella, like of IBS, but we never really looked deep into how to get rid of. And then the Muriel Jacobi is the one, the expert in Australia that trains practitioners. It's a SIBO doctor, so I'm with her. She's very good. So she trains practitioners to so that we can help other people how to get rid of that SIBO.
My God.
But that's when you do this extra kind of things to understand, okay, this is how we help people. Because it's really, it's the most important is to understand what type of gases are there. Because you
Yeah.
can go and treat whatever you want and it's not responding. Yeah.
So another question I have is kind of okay, these days, like there's so many things that we see on the internet, on Instagram, like I mean, and
Yeah.
now because I'm looking at things health related myself with what I do, I just have so many ads. And the one thing that comes all the time is gut health.
Yeah.
So now it's about the gut. Like I think it's been like that for 5, 10 years. I don't know. But it seems like
Yeah.
everybody now is talking about the gut.
Good, yeah.
Is it really all about the gut, or are people exaggerating a bit? What is your take based on what you see in your practice?
Yeah, it's funny. It's maybe not everything about the gut. Well, what put you in the first place? So it is about the gut, because it's a bigger picture. Like, well, where is this coming from? It's your lifestyle, it's your nervous system. How are you programmed? What type of information comes here? How stressful you are, how resilient to stress you are. So, and these things do affect gut as well. So, gut is a huge role. It is because there's so much nerves, and we have that saying. What do we say? Oh, I have this gut feeling to do or not to do. Because
Yeah,
the reason why we say it, there's so much neurons, so much nerves that
yeah,
it's true. Like my gut feeling is saying, go and do this thing, or do this, live this
yeah.
life. Don't listen to this. Go and
But they
go.
say that your brain is there as well in your gut.
Yeah,
So
yeah, yeah. So, yeah, like from the training that I was 10 years in training in nutritional therapy and functional medicine, all those trainings, gut is there. Absolutely. We look in the gut. But now as I'm going into this, the next level, the group, the Facebook group that I created, the next level transformation hub, it's actually a lot more to us humans than just changing body's chemistry. There's a lot of spirituality, there's our beliefs, the people that we surround, the whole happiness. Oh, there's so much more to this. Yeah.
all right. So let's say okay, so recently actually I was helping a client of mine. So she's lost like 23 kilos, but we still have I think she was at 117 kilos, and now we've lost 23 kilos, 24, something like that. Now it's evolving every 2 weeks, more or less.
Yeah.
My questions, obviously, I don't have the training that you have around the gut health, but let's say to you, what are the three things? I like three because people can remember them easily. What are the three things one person should do to improve their gut health?
Three things to improve the gut health. So the gut, we need to remember the gut loves everything what is fiber.
All right, so fibers, okay.
Yeah, so it can be fruits and vegetables, things like that, legumes. There's a lot of fiber. So as more fibers we have, as better. So, but this really is just generic. Now I'm just thinking in the back of my head, oh my gosh, if the SIBO client is listening, SIBO person is listening and start doing the fibers, that's gonna be worse. But just overall, the big
Yeah,
picture,
like the
saying,
regular
oh my God.
person. Yeah.
Yes, assuming you don't have anything like other conditions.
Mm-hmm.
So the fiber is the number one, in my opinion, and then all the things like fermented foods.
All right.
And
Fermented.
I think they are on the highway right now.
Yes.
We can do the fermented as well.
So what
So
are the top fermented foods that you would people
something that is easy and you can make it at home, like
would you have an example like
can you ferment cabbage?
okay,
It's easy to buy, easy to ferment. Cucumbers, can you do the fermentation of that? And
cool.
yeah, you can. Bit of onions to ferment in the vinegar, a bit of
Okay.
honey, something like that. We can, and they're very nice in on your sandwiches as well. Oh, now I forgot what else is there. These I think what I do.
So these are two
Yeah,
things.
kombucha. Kombucha is good.
Okay.
Would you like kombucha to do? That's easy as well. And then I don't know, like what else is there? There's so many fermented. You can ferment anything you like, and
Okay,
oh
so for the gut health, you said fibers,
yeah,
fermented foods. And what's the
fermented.
third thing we could do to improve our gut health?
The third thing, what we can do to improve our gut health is just to improve our brain and to be overall like feed the positivity into this machine and be happier, not to take shit if someone says it, don't take that personally. Do your own thing, focus on your own thing, learn little things that would help you to live better life, and that will affect the gut because this machine does affect your gut, same as gut affects your brain as well. Water is so important as well, and all the kind of as females in perimenopause, little things like sprouting and um,
Sorry, what is sprouting?
like broccoli sprouts, for example, so good, not just for your gut, but for your hormones as well.
Okay.
And you can buy in the shops all the sprouts, or you can sprout yourself. And what else is there? Oh my gosh, Lily, there's so many things that we can do to improve.
I guess if you've mentioned like being more positive, to me, what I've been practicing a lot is obviously meditation, but breath work is
Mm,
phenomenal because I am, as you know, a very intense person. And over the years, I got a lot of feedback from people close to me,
yeah,
very honest feedback. And I've been like, as I'm going through my own journey of
yeah,
being a health coach and all the other things
yeah,
we've done, I'm kind of into the vagus nerve and just working on my breath
yeah.
and practicing breathing exercise every day, twice per day. I really feel it has calmed me down massively, which for me is like such a massive achievement. So I'm just saying, I think it really works. It really works like the like breathing exercise,
Yeah.
meditation.
No, it definitely, absolutely, it works. It's amazing once you learn how to do that, not a shallow but deep breathing. Just refresh everything. So good, so good. Yeah, I'm happy that it works for you. I need to do that as well. I forget that I have those tools in the toolbox and like, yeah,
Yeah.
but good. Yeah,
Yeah,
definitely.
it's just about making time for those things
Yeah,
with all that you're
yeah,
doing and you're doing a lot.
yeah,
We know because we see you online all the time doing
yeah,
great things. Um, okay, obviously we talk a lot about nutrition
yeah,
everywhere, all the time.
yeah.
Now, do you think is there a myth about nutrition that you wish people could stop believing?
I don't know what they believe. There's probably a lot of myths, Lily. Like, but if that myth is serving me and I actually getting great results, I'm feeling cool and amazing. So, well, it doesn't matter if it's a myth or it's the truth. Do it. Make it your truth. But yeah, there's a lot of myths and
Okay, for me at least, and maybe you might add to this, the
yeah.
impression is like, and I used to believe that
Mm,
it's all calories in and burning those calories.
mm,
So it was like, okay, count your calories and you'll be
mm,
good. That's okay. You're gonna lose weight like that.
mm,
But we don't take into consideration maybe sometimes the metabolism, things like
mm.
that. So that's why every single person is different, and
Yeah.
nutritionists or people that pretend they're going to give you just a plan and it's just going to work for you. To me, that's a myth. That's one of the myth maybe you have out there.
Yeah, yeah, I agree with you because the plan that you get from anyone, it's definitely gonna work, but it's gonna working in the short run. But really understanding your body needs, you need to work with yourself and understand what foods are good for me, what is bad. So if you inflamed, if you like when you eat the food shouldn't be like making your gut upset or creating a bit of anxiety or something like that. It shouldn't. You should feel okay. You can continue with the day. You're not too energized, not too hyper, not too
Yeah.
low. Everything's working. That means you are doing the good nutrition and you're not gaining weight. If
Yeah.
this is the good thing for me personally. So yeah, and the myth, it's true. Like it's not really calorie in, calorie out because there's a lot of things like the inflammation that is happening in the body,
Yeah.
how well your body is cleansing that, how and it's here again in the
Yeah.
brain as well. Like, what's your thoughts? Because some people are saying, "Oh my gosh, if I look at that cake, oh, I'll get fat instantly," and it's true because you said so. You will
Yeah.
get fat without eating.
Very true. But I think there's another element is like people tend to think because okay, we want things fast, we just want the change now. So a lot of the time we are focusing on the outcome we want to get, but we don't really focus on the process.
Yeah,
And the people that I've been coaching around those topics, I'm always like, hey, the result is going to be that you're going to lose weight.
yeah,
But the first goal is to be super healthy, but
yeah,
permanently. I'm not trying to make you lose weight
yeah,
for the next 3 months. And then when you reach a destination, you got to put it back again. It's like, hey, we're just trying to be healthier
yeah.
forever.
Totally.
So that now, for those of us who are in their close to 50s, now for me,
Mm,
I'm working on the way I'm going to be when I'm 70.
mm,
That so for me, that's a myth as well because people are so stressed in the now and they
yeah,
want to change now. They don't realize it's okay. I don't need to change in 1 week.
yeah,
Maybe I need a month to
yeah,
implement a
yeah,
change slowly,
yeah,
but
yeah.
that's going to be sustainable.
Yeah, exactly. It's all about building just a little bit better habits and having that reason, why do I want to create strong, confident, powerful body? What is the reason for me? Like I can give you, for me, is my genetics from where I'm coming from. So if I do exactly what my parents did, I now will be with bone issues, obesity, thyroid issues, but I
Mm.
have a choice. So I can do what they did, or I can create my own life and do opposite what they did. And that's what I'm doing. I'm building and this is my why, because I know exactly I know my family and I'm not that far away from them. So I'll be the same exactly. But do I want this? No. And this is the reason why I decided to do different things in life because the habit that you build, small habits every day, they work. They give you the body, the health, the mind that you choose to create. Because I chose this. Simple. And this is my why.
You chose it, or maybe it chose you as well. Who knows?
Oh, yeah, yeah, absolutely. But yeah, I always choose like I want something and this is my choice. I'm going for this no matter how hard it's gonna be, but this is my choice. And then you start living it, this new habit becomes the same as brushing your teeth.
Yeah, totally.
Yeah.
All right. A question I would have would be obviously food is the medicine, right? However, are we getting everything from food, or do you believe that we all might need to supplement just a bit? What would you say on that? Because some people are taking, I don't know, 10 bloody pills every day. So, what is your take on that? Because,
Yeah, it again, we need to remember what condition people have. Are they chronic patients? Are they healthy, but they just want to live a little bit better to boost their
Healthy. Let's say healthy people.
healthy? Okay,
Like,
okay.
yeah.
So if you healthy, I personally the way I do it, I like foods first, and then I cycle the supplements because you do get benefit from time to time. From the sun, especially if you feel those long nights. There's no sun. Vitamin D during the winter time. Probably most of us need the vitamin D. You can easy test that from the bloods, so that's good to take. Then maybe some multi if you feel a little bit not the energy not good, or some
Mm.
B complex. Maybe if you feel like there's inflammation going on, maybe it's good to, and you don't eat fatty fish, you're afraid of fat. Maybe fish oil to incorporate, but just cycle these because, like during the summertime, if you are like eating a lot of fresh, like live foods, not processed, and you tend to eat anyway foods that when you buy and there's no labels, or there's label but you understand what the label are saying, the few ingredients. So yeah, foods are good choice, so maybe there's no need to take constantly supplement. Oh, the magnesium is the one that I like it as well, because it's a lot of transactions in the body happening where magnesium is required. So yeah, that would be my kind of, wouldn't go overly overly with supplements.
So vitamin D for a
Vitamin
lot of
D.
us, and the darker your skin is, by the way, the more you need vitamin D.
Yeah, that's a
Most
good
people
point.
don't know. I kind of thought, oh, because I'm darker, I don't need it. It's
Yeah,
actually
yeah,
the opposite. So that's
yeah,
good to know.
yeah, yeah. Yeah,
Magnesium, you said,
yeah, magnesium.
omega 3s.
Yeah, and maybe some good multis if you feel bit of
Mm.
energy, a bit something, not yourself. So these would be like kind of safe to recommend. But always, if you some medication is going on and you take certain medications, that's we are trained to look into drug nutrient interactions to make sure there's no interactions, it's safe to take. So
Yeah.
that's our job to assess that. Yeah,
And
but
you said we have to recycle them. So it means that we should not be on them
not forever.
forever all the time. We need to recycle them. So no, that's a good thing to tell people because not everybody knows. So
Yeah, and so you have to be careful as well because now a lot of supplement network marketing, things like that, that people want to make money out of, and it just you need to use your own brain. Do you really need it? Can you get that from the food? If you eat food, as I said, if you eat oily fish 2, 3 times a week, maybe you don't need then the fish oil.
yeah.
Yeah.
Question, because with a lot of ladies my age or our age, a lot of people are taking collagen, so I take it from time to time.
Yeah, me too.
So I'm just curious to hear your thoughts on that. So question is it good to supplement collagen? Question one. Question two, now we know you said recycle, so don't take it all the time, of course. Okay. So is it good? Which collagen do you recommend people take? Because I want to check what I've been told by other people. I want to know if it's
Yeah,
if it's
yeah.
it's a good advice. So I'm curious to hear your thoughts on that. And do you think it really has an impact on the skin?
I actually testing now for a few years, but I do the recycle. And to be honest, I don't see any improvement in my skin. I think I'm getting old now. Everything is like, oh no, it's not working probably. But then again, I don't know. Maybe it's something happening inside of my bones. One of the practitioners was saying to me something. It wasn't from me, but um, your body is very smart. So because I train intensively. So then maybe that's where it's sent, all that collagen that, in the bones and in the muscle fibers, because you train so much, that's where the need is for the recovery, maybe not so much your skin, and that's why you're not happy with your skin. So I don't really have you need to try to give it a try and see.
No, I've done it for over the years. I had the impression, but I don't do it all the time.
Yeah,
I
so
had the
do I.
impression at the beginning that I could see a change, but I
Yeah.
don't know. Sometimes you're more rested, so your
Yeah,
skin
it
is more hydrated as well. So
Yeah, yeah. So I don't really have the answer for that as well. I do it. I do. I just testing different brands and different. Hold on, and actually escaped the brand that I wanted to give it to you. It's something that has enzyme to helps you to break that collagen even more. Oh,
yeah.
and I forgot the name of that. Oh my
You
God.
can tell me later, and I'll put it
Yes, I do that.
below.
I tell you.
And what type of collagen? Because I've heard of collagen marine. I've been
Oh
told.
yeah, that is, I think that is, oh, is that a combination of bit of everything or marine collagen? I used to take marine only, and then I think this one might be combination, bit of everything included, and tells you how much is there, different type of
Okay.
fibers there. So it's good for your bones, it's good for other things, for your skin. Uh,
Yeah.
yeah, but I don't know. We really need to test because this
Yeah.
yeah, different opinions, as you said, different things, and most of these are coming from the network marketing, trying to sell the product.
Mm.
I'm not against the network marketing because it could be something good that I'm not aware of,
Mm.
but yeah, just test it and see if it works. For me, for skin, I really wanted to improve my skin. No, I don't know. Yeah,
Cool. That's fantastic. I'm conscious of time and I really appreciate because I know you're busy. Even on Saturdays, you're on the schedule. So I really, really appreciate you taking the time. I have a last question for you.
yeah.
And it's like we see that there's a lot going on. You have research about the microbiome, you have the epigenic, you have so much going on.
Mm.
Where do you see natural therapy going?
I
And that's a
say
very hard question, I know,
it
but
is, yeah. It is very much. Even recently, I got a collaboration with the lab that is AI driven. So I haven't looked into the offer. What do they want? But I see a lot of probably AI gonna be stepping in and helping to connect maybe your genetics, your different tests into one. Hopefully it's going to be maybe cheaper for all of us, and then helping to based on our gene, based on our gut microbiome, and based on our hormones to create for us the protocol that maybe we can implement. uh, don't know. It's interesting, actually. I'm interested. I'm curious where this is going as well, because it's so much work is happening, and every time I'm getting the training, the speed of what happens in few months' time is enormous. And it's like, wow, I didn't know this. This thing is happening now. There's so much going on. So it's interesting to see for me as well where we going. Yeah, because a lot improvement, a lot of happening with all the tools, all the devices, everything. There's soon gonna be like attached little thing, and it's gonna tell the hospital when you're gonna have, or maybe it's already there, when you're gonna have your heart attack, things like that. Well, that was from the recent seminar, from last year's seminar from Professor, forgot his name. And yeah, he was talking about these things, that you're gonna be notified. Your heart attack is coming now in the next 7 days. Go to hospital. Like it's just amazing with the AI things. It's a lot.
yeah,
So yeah.
massive. So where people can find you?
So people can find me in, if they depends what they want. They can come and join my Facebook group, Next Level Transformation Hub, where I get a chance to interview amazing practitioners in different health, wealth, mindset areas. Um, if they want to learn more, so that would be a space to come. If they would like to get the hormones done, to get the gut test done, or to start looking overall your health, achieve that perfect, confident, powerful, energized body, they can come to myfmclinic.com.
Cool. Last question, and I'm very selfish. It's more for
No,
myself.
no, we still have time.
So it's like, okay, like I'm questioning myself around my hormones because I don't feel like I feel very good. I have energy and all that jazz.
Yeah,
I'm thinking I can tell my metabolism is changing a bit because I have that little tire around my belly.
yeah.
And I'm just curious, like in terms of let's say if I came to you and I said, look, could you assess for me like what type of diet I need? And these are kind of my preferences. So my typical diet is very Mediterranean style.
Hmm.
I don't do dairy. Like,
Yeah.
would you be able, based on, like, I suppose I'd have to do a blood test, and then you look at my bloods, and then would you be able to tell me if that little tire, like, could you help me basically with my diet or?
So I would say, Lily, why don't we run the Dutch test and see what's going inside? And in the meantime, can you do the questionnaire? Them two I have to. One is the body systems and one is metabolism to assess you fully. And then the diet as well. You be honest. You give me everything what you eat because
Mm.
sometimes it's just difficult, to see. Sometimes we think the food is good, but if for us maybe not good. Maybe we need to take a break a little bit from that food.
Yeah.
Um, so yeah, and the test would be the one that I would like to suggest. I'm personally a big fan of the Dutch test. I did it before I was going into perimenopause. Now I bought another one. I'm doing as I'm in perimenopause. Once I'm gonna go into menopause, I'm gonna do another one. And once I'm in postmenopause, I'll do another one. Why? Because it's so important to understand how your adrenals are functioning. That's your energy.
Mm.
Because when we are older, the ovary is gonna shut down the production of all the sexy hormones. Adrenals gonna take over. If you're not supporting your adrenals, if we see the adrenals need help, I mean, you're not gonna have your sexy hormones, and you feel very much miserable and unhappy. So it's good to address these. The other thing why I like it because it shows you how your estrogen is metabolized, like which pathways they are going. Are they going the bumpy road? That creates a lot of punches into your DNA, and that's a lot of ovarian, breast cancer in the future. Or they're going the good pathways. If they're going bad pathways, they have to be redirected.
Mm.
The other thing why I like it shows you all the nutrient, not all, but most nutrient. Are you sufficient? Are you deficient? And all that, and how the liver is processing everything. So it's a beautiful test to invest once in every 10 years in that test. It shows a lot. It tells a lot about you. And maybe that's where, to understand what is going in all.
Okay, sign me up. Seriously, I'm serious. I will reach out after this.
Yeah.
But you tell me when you're available and
Yeah, we
how much
can.
you got to charge me, and we need to do something. I need your help. Anyways,
Yeah, it's a good test.
okay. Before we close, any last word of anything you want to share? You want to tell the audience? Any advice? Anything
Yeah.
for women
Yeah.
around?
Yeah, ladies, just don't look at the other people. Just be you, connect with yourself, and just, be a little bit selfish. Love yourself. Love yourself. Enjoy yourself more. Do fun things with life. And who cares what? You don't have to fit with, into anyone's else's created norms. Be you, be happy. That's my final message.
Ooh, that was powerful. And that was Ingrida for us. Ingrida, thank you so much. Thanks for everything. I'll put your details below the video so that people can get in touch. And thanks. I hope to have you again for another topic.
Absolutely. Would love to. Thank you so much, Lily.
Thank you so much. Have a beautiful day. Cheers.